Youngest New Yorkers could be just a month away from getting their first COVID-19 shots after Rockland-based Pfizer released new data today.
News 12's Jonathan Gordon is outside of a pediatrician's office in Yonkers. So, Jonathan, how would the vaccine for kids under 5 work?
Well, Tama, Ian, Pfizer says that giving kids 3 shots of a smaller part of its vaccine will give these kids a strong immunity for this entire age group.
Nearly 18 million kids nationwide have gone this entire pandemic unprotected from the virus, but that could change by this summer. Pfizer submitted data to the FDA Monday, seeking its approval to start getting COVID-19 shots out to the country's youngest population.
I'm cautiously optimistic, that I'll be able to vaccinate like a larger portion of my patients and protect them against COVID.
Hudson River Pediatrics Dr. David Levy says the vaccine is critical to combat the virus, even if kids don't seem to get COVID as badly as adults.
We're not going to really be able to truly tackle COVID unless you have this age group somewhat protected, with vaccines.
Pfizer's announcement comes as COVID-19 cases are still elevated. New Yorkers are still testing positive at a rate close to what it was at the end of the winter Omicron wave, not including those who tested home, even though the state's weekly average case rate declined over the last 6 days.
We're seeing a lower percentage of hospitalizations and a lower level of fatalities, even as we see a continuing steady rise in the number of people that are infected.
And earlier this month, Moderna asked the FDA to authorize its COVID vaccine for the country's youngest kids.
So, Jonathan, how fast could we see parents getting access to the vaccine for their kids?
Well, Ian, the FDA's panel of independent advisors is scheduled to meet on June 15th to consider both the Pfizer and the Moderna vaccine for kids. Send it back to you.